This is Daniel from Breakthrough Sports Performance.
And this is Steven from Breakthrough Physical Therapy.
And today we're going to talk about the squat. The squat is not only a very good functional movement skill to have, but if done right, a very good functional movement test. And we use a postural restoration functional squat test at our facility to assess physical therapy patients and performance patients as well.
And in the physical therapy side, when people come in with different complaints, knee, hip, shoulder, back, ankle, you name it, this test is such a full body test that it gives us a good perspective on how their whole body's working together. So we use other tests, but this test is a staple of many of our clients. This is a postural restoration test. It's called the functional squat test, and it's found in the pelvis restoration course. But the reason we use this test is to look at how well your pelvis and your thorax, which is your rib cage, how well they are working together. Are we looking at legs and arms and other things? Sure we are. But those two areas are a huge focus of what drives your ability to squat optimally.
And from a performance perspective, if an athlete cannot squat well, they're not going to be able to increase intra-abdominal pressure. They're not going to be able to generate force very well. Maybe they have some compensation at the pelvis or at the knee, which can cause injury down the road. So we use this test to make sure our athletes not only can put weight on their back, but also see how well they're performing.
We're gonna go through the functional squat test. There's one thing that we all do both on the physical therapy and sports performance side before we would check this test, is we would check to see if your pelvis and your rib cage and neck are in a neutral position. So I brought this pelvis model just to show you if the pelvis was turned or tipped forward in some way and your pelvis therefore is not neutral, that will affect how you move through space. So in our functional squat test, we just want to make sure, are you neutral or are you not, before we would check, just to have a better idea of what's going on with that test. So now we're going to show the functional squat test and maybe what you're looking for at each criteria, at each level, to see are they able to get fully into a level 5. So this test has 5 levels. So you don't just go straight to level 5. We're going to take Daniel through each level one by one. And if he can't get to the next level, then that's where you would stop the test and you would grade it at that level. So level 1, so the starting position before we do level 1 is he's going to have his feet straight ahead, under his hips, and he's going to start now to initiate a level 1. So a level 1 would be unlocking his knees, reaching his arms forward, and going into a slight posterior pelvic tilt. Okay, so the way I describe that is if you had a belt on, you want to think about the front side of your belt coming up and the back side of your belt going down. So you're tilting your pelvis. So Daniel's doing a pretty good job of that. I would give him a level 1. A level 2 is can he maintain that and start to drop down even further, not to parallel, just maybe about halfway, right about there, and can he maintain that position? You're also looking for, are his heels staying down? Is his knees going forward? If either one of those are not happening, then you will stop the test. So Daniel, give us a heels off the ground version. Okay, so that would be a no-go. And then give us kind of where you would sit back. Okay, so we're gonna pause that test right there and say he cannot achieve a level 2 if either one of those happen. All right, so now we've gotten through level 1 and level 2. Now we're gonna transition to what does a level 3 look like. So same position, he's gonna start by going through level 1, which is a slight posterior pelvic tilt. He's got that, he's gonna start to lower down for a level 2 right there. Now he's gonna continue to drop towards parallel and start to bring his chest towards his knees while trying to maintain a pelvic tilt. He's gonna try to get his hips just below his knees to be a level 3, okay? So this is where you can start to see how difficult this might be for a lot of your athletes. And a level 4 would be, can he come all the way down towards the ground and hang out in this position? That's another thing you want to check, is how comfortable are they at maintaining this position. All right, so now we've completed the test. Feel free to try this test on your own. We're gonna now show you some exercises that will help you address whatever level you ended up at.
And as mentioned before, These exercises will not only address limitations at the ankle, knee, and hip, but also limitations of a pelvis that might not be in a good position or a thorax that might not be in a good position that could cause limitations in your squat.
All right, so now we're going to show you a level 1 exercise that can also be applied for a level 2. So what you're going to do is take a ball, you're going to put it between your knees, and you're going to stand about 7 to 10 inches away from a wall. You're going to rest your bottom on the wall, and we're going to teach you how to do a posterior pelvic tilt with having a support for your wall so your back can relax. So what you're going to do is find your weight through your heels. You're going to gently let your knees go forward and your arms go forward together. My back is going to round out, and I'm going to try to keep the small to mid part of my back on the wall. From that position, I can go down a little bit further if needed, but remember, we're just trying to go after teaching you how to get a posterior tilt. So you want to hold that position, take an inhale through your nose, breathe into your back, breathe out, do a small reach without your back coming off the wall. You should feel some muscles in your hamstrings and your abdominals.
The next exercise to improve your functional squat test is called a squatty bar reach. This you can use for a level 2, 3, or 4. So all you need is probably a broomstick, or if you have a stick laying around, and a door frame. So you're going to put the broomstick pull in the door frame, get a good hip width stance. You're going to retract your rib cage and perform a slight posterior tilt. Maintain the weight in the heels. Then just let the knees drift forward, maintaining that position. Take a deep breath of air in through the nose. Exhale out and feel the abdominals engage. And from there, you can just adjust the position. So from a level 2, you can go down into a level 3. Just make sure you maintain that posterior tilt to feel the load in the heels and the hips. Then, again, you can go down and hang out in a level 4 and just hold and breathe and perform this position to improve your functional squat test.
All right, so this last exercise is going to help not only with getting the rib cage and pelvis to move better, but it's going to work on your ankle mobility. So a lot of folks have tight gastroc calf muscles. So doing this exercise will help lengthen out that muscle, as well as getting some of the things that we want in the rib cage and the pelvis. So if you feel that your ankles are part of your limitation, this would be a great technique for you as well. So what you're going to do is set up in an all-4 position. You're going to put your hands right under your shoulders. You're going to put your knees right under your hips. You're going to take an inhale through your nose, and as you breathe out, you're going to push your ribs towards the ceiling and move slightly forward over your wrists. If you have wrist issues, you can move your wrist forward to start so that it allows you to still move your body forward but not put so much strain on your wrist if needed. So once I've got that position, I'm just going to do a couple inhales and exhales in this position. So I'm breathing into my back, I'm breathing out, tucking my abdominals in. As I start to get used to this position, I'm then going to rock back towards my heels with the goal of getting my heels on the ground, and I'm going to try to maintain breathing into my back. So I'm breathing in, I'm breathing out, full exhales. If you're like this, or if you have your heels off the ground, you may just want to hang out in this position. You can elevate your hands if needed to allow you to get more back on your heels, but that's kind of step number 2. After you achieve this position where you're breathing, you then rock back. If you can't get your heels to the ground, spend some time working at that. If you've got your heels to the ground, then you want to start to bend your knees and walk forward, trying to keep your heels on the ground. So my knees don't want to bend too far, but I want to bend a little bit so that I can allow my heels and my ankles to dorsiflex. Okay, so try that technique out if you feel that your ankles are a part of your restrictions.
So hopefully those tips and exercises help you improve your squat technique. And remember, this is a functional movement screen. This isn't necessarily a position where we want to put a lot of load on you. This is to show if you can load into a squat. I hope this helped, and I hope this helps improve your squat.